Hello everybody, my name is Alexander Armstrong. I am a student at Texas Women's University and I am here to talk to you about physical psychology, or rather, physical therapy. And in this presentation I will discuss with you what it is, what it takes to earn a career in it, and most importantly, how it impacts others' lives. And there's my name. So, what exactly is physical therapy? Well, simply put, it is a branch of rehabilitative health that uses specifically designed exercises and equipment to help patients regain or improve their physical abilities. It is appropriate for many types of patients, from infants born with musculoskeletal birth defects to adults suffering from sciatica or the after effects of injury or surgery. Oh, and to make it a little easier, it's abbreviated to PT. Not to be confused with the playable teaser PG, the Gansel Silent Hill game. Anyway, to practice as a physical therapist in the United States, you must earn a Doctor of Physical Therapy degree from a Commission on Accreditation in Physical Therapy Education. The length of DPT programs usually lasts about 3 years, and many programs do require a bachelor's degree for admission as well as specific educational prerequisites, such as anatomy, the identification and description of the structures of living things, physiology, the study of how the human body works, biology, the study of life and living organisms, chemistry, the study of matter and the chemical reactions between substances, and physics, the study of matter and its motion through space and time, along with related concepts such as energy and force. A license is required in order to practice as a PT or work as a PT in the United States. You must also pass the National Physical Therapy exam, which is administered by the Federation of State Boards of Physical Therapy. There are some training locations to simply become or even learn about becoming a physical therapist. Through my research, I've discovered 5 close locations within Texas. There's Ortho Texas, Orthopedics and Sports Medicine. There's one here in Carrollton. So, there's ATI, Physical Therapy. There's Physical Therapy and Balance Centers, Greater Therapy Centers, and Premier Rehab Physical Therapy. Of all of the 5, I went to the Ortho Texas for this project, and it seems like all 5 have similar facilities and resources altogether. So, yeah. School-based physical therapy, which of course requires a medical diagnosis in order to provide treatment, is a support service to the student's educational program. School-based physical therapists use therapeutic activities that may improve a student's ability to physically access his or her educational environment, such as helping disabled children. They are a growing necessity in our education system, so applying for a position at a school can help a lot of children in need. Physical therapists and physical therapist assistants are part of a collaborative care team in various hospital settings. The care that they give can range from acute to rehabilitation. Physical therapists are increasingly part of emergency departments, which is why more and more are signing up to work at hospitals. As for the annual earnings, which of course is necessary, you can't do a job without money. Since November 28, 2020, the average annual pay for an entry-level physical therapist in, say, Frisco is around $55K a year, which approximating up to $27 an hour. Now, I know, it's not exactly glamorous. It's not that much high paying, but to be honest, it's really depending on whether or not you're looking for a cushy job with little impact on people in the world around you, or if you are looking for a hard-paying job with a very big impact on the people around you and the world. It all depends on what you want to do and how much you want to be paid. There are also several books dedicated to helping others understand physical therapy, as well as help understand how their bodies work and accomplish tasks in their lives. Here are 3 examples that I've found and researched. The first one is Explain Pain by David S. Butler and G. Lorimer Mosley. This title is a must-read for any physical therapist who treats chronic pain patients. It'll help contextualize your patient's pain as well as provide a deep, evidence-based understanding of how pain functions in the human body, from its genesis to its stubborn persistence even after tissue has healed. This book is also popular with a lot of biologists, as you can tell. The next is Muscles, Testing and Function with Posture and Pain by Florence B. Kendall. This hefty book may be an oldie, but it is a goodie. And this goodie serves as a comprehensive guide to muscles and manual muscle testing, as well as a guide to postural conditions, postural assessments, and their subsequent treatments. And finally, there's Dare to Lead, Brave Work, Tough Conversations, Whole Hearts by Brene Brown. This book recommendation is for leaders and owners in a PT practice or rehab organization. Dare to Lead is chock full of insight about workplace culture. It dives into the importance of holding your values near and dear, as well as the need for embracing some often overlooked or downright spun traits like vulnerability, trust, and resilience. As a clinical psychologist, this is a book I am really interested in getting. For this project, I did an interview at Ortho, Texas, specifically the director of the Carrollton department, Tiffany Boulware, PT, PDP, DPT, and MTC. When I interviewed her, she did inform me of some of the duties and the therapists and other coworkers that she had and how much of them she had to handle. Some of which did include patients and learning about their physical conditions and symptoms, diagnosing movement and dysfunction, and developing a treatment plan for them. She was also in charge of teaching patients how to properly use therapeutic exercise techniques, as well as providing stimulation or massage to promote healing. Now, after hearing about this, I did not expect that it would expand my knowledge of how different psychologies work. I mean, I always assumed that they had to deal with researching more and more of how they work and applying that to either scientific studies or working with patients in an office. But now I've come to see that not every psychologist or therapist has to confine themselves into an office in order to help people. Now, about the interview itself, it honestly felt like every other interview, which is kind of odd considering I've done very little interviews in my life. Interviewing with someone with a significant amount of knowledge and degrees in the field of physical psychology, or physical therapy, if you prefer, did give me a sort of inspiration and appreciation. When I first heard that she was the director, I simply assumed that she would be locked in, well, not locked, but confined into an office, and that she would be personally happy about that. I would have, because honestly, working in an office, a 9 to 5 job, actually sounds pretty good for someone like me. But I see that not everyone sees it that way, and not everyone has, as I said, has to be confined into an office. You can work in the field, you can work with patients, you can work in a hospital, school, as discussed earlier. You can work in many different ways and places, not just in an office. Physical therapy and occupational therapy are two different types of rehabilitative care. The goal of rehabilitative care is to improve or prevent the worsening of your condition or quality of life due to an injury, surgery, or illness. However, there are similarities to these careers. For example, overall purpose. PT and OT, that's physical therapy and occupational therapy, both aim to improve your overall functioning and quality of life, and knowledge about how to maintain your health and well-being. Conditions. There is considerable overlap with the health conditions for which both therapies may be recommended. Design. Both types of therapy provide hands-on care that's tailored to the patient's specific needs. Tasks. There can be some overlap in the tasks performed. For example, occupational therapists may teach stretches or exercises. Physical therapists may work on movements to help with daily activities, such as getting in and out of a bathtub. And finally, goals and monitoring. Both types of therapy set goals and assess your progress as you work to achieve them. While there are some similarities between physical therapy and occupational therapy, there are also key differences. The physical therapist will work with a patient to help strengthen their knee and increase the range of motion in their knee joint, for one example. They can help them move more easily with less pain and discomfort. Occupational therapy focuses on helping you perform those daily tasks more easily. This type of therapy focuses on improving your fine and gross motor skills so that you can carry out specific day-to-day activities. The occupational therapist will also focus on making your home or school environment more optimal for your everyday life. Like, for example, an occupational therapist may help someone recover from a stroke by learning how to do daily tasks, dressing, and eating with utensils. They may also make changes in the home, like installing a grab bar in the shower. There are also similar careers associated with physical therapists. Audiologists are experts who can prevent, diagnose, and treat hearing and balance disorders for people of all ages. Audiologists provide professional and personalized services to improve a person's involvement in important daily activities in their lives and better their quality of life. Chiropractors use spinal adjustments and manipulations to other parts of the body to realign the bones and joints so as to reduce pain, restore range and motion, and improve flexibility, as well as balance and coordination. Nurse anesthesiologists provide aesthetics to patients in collaboration with surgeons. Anesthesiologists, dentists, podiatrists, and other qualified healthcare professionals. Athletic trainers, also known as ATs, specialize in the management, prevention, and recovery of injured athletes. Athletic trainers collaborate with doctors to provide emergency and follow-up care, as well as develop injury protection and treatment programs for injured athletes. So in conclusion, physical therapy helps people of all ages who have medical conditions, illnesses, or injuries that limit their regular ability to move and function. Physical therapy programs can help individuals return to their prior level of functioning and encourage activities and lifestyle changes that can prevent further injury and improve overall health and well-being. Primary care doctors often refer to patients as patients to physical therapy at the first sign of a problem, since it's considered a very issuing problem. But simply put, it's a career worth studying. It really is. So many people with so many injuries need help, and who else to help them with physical therapists? As for my final thoughts, I am a clinical psychologist, so physical therapy is something I will not be majorly studying. However, it is something I would like to study on the side. It honestly can help me understand how patients move, how they behave, and how they choose to act throughout life. When I eventually become a clinical psychologist, I will look back 5 years earlier when when I was studying for my bachelor's and eventually my master's and hopefully my doctorate. And once I finally get my own office, or at least a share office, I'll look back and think, man, learning about physical therapy actually helped me a lot in ways I never expected. It helped me understand how patients are the way they are with their bodies. It's something I never expected to learn now. It's never something I expected to learn before, and perhaps it's something I will expect to learn more in the future. So anyway, here are the sources for what I used in the project. Thank you everyone for watching. I hope this inspired you to delve into physical therapy for your career. It did inspire me to study for this project. Thank you.